Hi everyone, I'm Abigail Salvador. My previous procedure was alar bunching last year, March 2023, and I really love the result. I came back for another alar reduction to maintain it using non-surgical procedure. Non-surgical, less downtime, less pain. I choose CSA because I'm in the good hands of Doc Contessa.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's welcome Miss Abigail Salvador. Alright, okay, so a year ago, we've done a procedure called alar bunching for Abby, right? So, like to be exact, more than a year, right?
Yes, Doc.
Okay, and it's been a year, and PDO threads hydrolyze in 12 months' time. So, she's now due for another alar bunching. 2 months ago, you've done the threads on the bridge as well as the tip columella, right?
Yes.
So, we haven't done any repeat alar bunching. It was only the last year, right? And looking at Abby, what are you doing? You're becoming younger and more beautiful. I think she's doing a lot of maintenance treatment. And I also noticed the under eye area because I think we also did PDO threads under eye, right? You had the derma spring because she has this kind of puffy under eye. Puffiness under eye, right?
Yes.
Like eye bags. And there was a reduction just using the PDO threads. And I think you did some Botox injections? Because some of the wrinkles are going away. What's your secret, Abby?
You, Doc?
CSA.
Yes,
Okay.
CSA.
So far, how were you? Like after the alar bunching that we've done a year ago, and so, what did you notice?
I noticed, Doc, yung alar ko na
Narrow.
narrow po.
Because we had a photo of that, right?
Yes,
Like
po, Doc.
we had a picture, like it was on a, we call it like caudal view or the basal view, where you can see the shape of the alars, the nostrils, and also the tip columella. Okay, because there are 3 types of the nasal tip. We have the leptorrhine, the mesorrhine, and the platyrrhine. So, flat. The platyrrhine. Yung leptorrhine, that's the one that's really high and really pointed. So, mesorrhine in between. So, ako okay na ako sa mesorrhine. I'm already happy with that meso. I don't want it too high. Of course, you don't want it too flat. I also need actually an alar bunching and a tip columella treatment, okay? I just did remember Abby, when I had like a nose tip, the nose bridge, just the nose bridge, I had some threads there. I had PCL threads. It was like more than a year ago. So I think I had 6 pieces of the bridge threads, PCL. I haven't really like injected the nose tip columella, plus haven't done the alar bunching. Buti pa si Abby, okay? But for now, let's do Abby. Then hopefully I can do mine next time, okay? So we'll show the procedure when CSA Medical Aesthetics return. And we're back. So we're doing a procedure called alar bunching for Abby. So last year we've done this, and you already know what are the steps here, okay? For Abby right now, okay, we'll still do a tip columella projection. And I'll be also injecting fillers on the piriform area there because this one will restore volume at the same time push the alars inwards, okay? Plus, we'll also be injecting filler in the anterior nasal spine to push the columella upwards. So, we'll be doing the combination tip columella projection, also the filler on the piriform area, and also here at the base of the columella plus the alar bunching. Okay, so we have to, okay, I'll start with the hyaluronic dermal filler here for the piriform fossa. Okay, so a while ago they already applied numbing cream, right, Abby? And it was left for about an hour, Abby. Okay, so this is just a filler to fill in the piriform area there. You can inject 0.2 to 0.3. There you go. And let's go to the other side. Okay, so this one will restore volume in this area. Okay, so it's actually in the so-called nasolabial triangle, and you have to reach the bony area there. Okay, you have to go up to the maxilla. Okay, so I'm just giving 0.2 to 0.3 of my hyaluronic substance. It's a high G prime product, large particle size, high molecular weight. So we need to use a high G prime type of a substance. Okay, now let's proceed to the so-called anterior nasal spine. So actually I still have a remaining around 0.6 here. Okay, so let me just inject a bit into this base of the columella there. So this filler also has lidocaine with it, so it's gonna numb the area. You're good, Abby?
Yes.
Okay. Then after that, we'll be doing a so-called tip columella projection. Okay. So this will enhance the nose of Abby. It rejuvenates her. She becomes younger with a well-defined nose, projected tip, narrower alars. So again, your alars should be within the so-called intercanthal width. Okay, so this is a lidocaine. Okay, and I will numb the tip of the nose for my entry point. Okay, then I'll use a gauge 19 needle to make that puncture. And now I have this Wyco PDO thread, or we call it Wyco short, that's specific for just the tip columella. Okay, and we want it in the so-called intercrural space there, and we have to reach the so-called anterior nasal spine onto the bone. So we're using a Wyco 40 millimeter. Okay, then pinch. And the last one here, we'll just use 2 pieces of this. Then after that, we'll just go to the so-called alar bunching. Okay, you're still good, Abby?
Yes, sir.
There you go. Now for my alar bunch, I'll numb the entry point on one side, and then the exit point opposite side. Okay. And then we'll make a puncture using our so-called gauge 19 needle. So puncture here, and OS. Okay, make sure you support that, and then the opposite side there. So you're making puncture of your so-called alar grooves. Okay. Then I'm using a 60 millimeter type of a spiral cog here. So we'll have to direct it into the entry point onto the bone, and then glide it. Glide it in the soft tissue layer. You're still good, Abby?
Yes, sir.
The OS, please. Then just try to reach the opposite exit point there. So we did already the puncture here on the opposite side here. So we want the soft tissues again to be bunched. That's why they call it alar bunching. Bunch towards the middle. Okay, there we go. And then we're gonna pull it out. Again, we need a second one there. So it's gonna be, there's gonna be a lot of bleeding because we're working on the alar groove area. And then this is a second one. Then we just have to bring it out. Same exit point. Make sure it's in the same exit point. Okay. Looking at the exit point. Yeah, there you go. Then we pull out. Then we can now make a knot. So we want to stabilize this threads here, okay? So just make a knot. You're still good, Abby?
Yes, Doc.
So release one and the other one. Then we just create the loop. Okay, release that one. Then we're gonna tie it. Okay. And same thing on the other side. Once we have done the knot, we'll just cut the ends. Okay, so this is just knot. Then we'll be cutting the ends of the threads. Just knot this. Okay. Still good. Okay. So make a second knot for this one. We'll just have to pull it again. And just a second one, and we're almost done. Okay, then just cut the strands. So there you go, we've done the alar bunching for Abby. We'll show you the result when CSA Medical Aesthetics returns. And we're back, so let's show the result to Abby. Abby, here is our mirror for you to check on the outcome of what we've done today. So it was like a combination of filler onto the nasolabial fold here, plus onto the so-called anterior nasal spine. We also did tip columella thread lift, plus also the alar bunching using our spiral cog 60mm length. So Abby, how are you?
Thank you, Doc.
Okay, so for now, there will be like difficulty of like, opening your mouth. And there are lidocaine there. We've injected lidocaine solution. Okay, so it's kind of hard for you to talk or even like chew something for now. It's gonna be a temporary thing, okay? Because of course we did also fillers. Then we have threads there. Then you have also the transverse threads. It's kind of like in the soft tissues, like on the maxilla bone, and it's a connection with that of the oral mucosa, so a bit of difficulty in like when you eat and when you talk. Okay, it's gonna be temporary, Abby. So how are you? Anything to say?
Thank you, Doc. I'm so happy.
Yeah.
Pero na.
Right. So this is a part 2 of your alar bunching, okay? Because we've been explaining that PDO threads, they hydrolyze or they are absorbed in 12 months time, okay? That's why like I've already seen Abby with her alars flaring or widening. Later on, we will still do a so-called alar Botox. We also want to inhibit the flaring muscles, the dilator muscles there. We will also inject botulinum toxin to further narrow the alars, the nostrils, okay? So a bit of like a swelling there, soft tissue swelling, but it's gonna, go down in few days only. Like some people 2 days, 3 days. Day 4, it's already going away. It's gone already, okay? So,
Thank you so much.
how was the experience? Tolerable?
Yes, tolerable.
Yeah.
Napakagaan ng kamay mo talaga, Doc.
Yeah. I know, kind of difficult to talk right now, okay? The others are concerned like with this lengthening of the upper lip area, with the subnasale to the upper lip. Well, there will be like this temporary kind of lengthening of that or flattening of the philtrum, but this will also soften. Like, we'll still see Abby in a week. We'll do a follow-up on her, okay? And like when I was doing the insertion of the spiral cog thread in the soft tissue layer, it's kind of like there were like easy. It's an easy glide, okay? There are cases that when we inject the cog threads, the glide is not so easy because of some soft tissues there kind of give resistance, okay? But for Abby, so far so good, considering she had done like this alar bunching a year ago. And then actually I still added a bit of the PDO threads on the bridge on the dorsum just to still elevate elevate that area there. Ayan, medyo may konti pang the lidocaine solution is still coming out from the entry point. So we have this entry point in the nasal tip. We also had entry points on the alar groove areas. Okay, we did the knot also. As much as possible, we want the knots to be embedded inside the skin tissue layer. Okay, so we'll still wait for Abby's complete recovery. Okay, thank you so much, Abby.
Thank you so
okay,
much,
like if you want to check on Abby, do you have like a social media they can follow you?
Yes, you can follow me to my IG, Abby
IG. Yeah, okay. And if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please watch the episode of Abby, her first alar bunching, in our YouTube channel, Contessa Salvador. And thank you so much for those who have already subscribed to our channel, and please do continue watching our new episodes. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.